The consideration for us is what was in the autologous setting, what is the easiest area to harvest?
Yeah.
What is the least invasive area to harvest? And that typically is abdominal fat. Doing a small liposuction procedure where you're taking anywhere between 20 to 40 grams of tummy fat, and then doing an isolation expansion process. Fat actually is a rich source of mesenchymal stem cells. It has anywhere between 1 to 10% mesenchymal stem cells. Marrow can have as low as 0.01% mesenchymal stem cells. So whilst it's accepted or considered to be a rich source of stem cells, in regards to mesenchymal stem cells, which we use in musculoskeletal medicine, it is a very poor area. So you do actually have to concentrate bone marrow samples. You do have to potentially do a much more arduous isolation expansion process if using bone marrows. So fat was the easiest source. It's also been shown that it's probably the best cell source in regards to high expansion of cells. So that's been fortunate for us. And the clinical research has shown fairly reproducibly that fat-derived stem cells tend to be the most efficacious in musculoskeletal medicine.
I was just going to ask you that. Is there a difference in efficacy between the bone marrow and the fat? And from your research, you're saying that. But yeah, well,
It's really interesting because the source varies between research. And I think if you look broadly, and this is where we look at the research and the level of research and the quality of the research, and we definitely need to do far more randomized controlled trials in this area. We definitely need to use randomized controlled trials with larger patient populations as well to show reproducibility. But if you do take those randomized controlled trials and the ones which have been well designed, you do see adipose tissue tends to be more consistent in regards to pain and functional efficacy and disease modification. Bone marrow does actually get very good results as well.